I got trained in EMDR in 2006, and my primary motivation for getting trained in EMDR was having such a phenomenal experience with it as a client. And I literally thought, I can't not offer this to people. It's just too powerful. So I was working in a pretty stereotypical drug and alcohol 12-step based agency at the time, where the pervading sentiment was, we don't touch trauma here because we're going to destabilize people. And I had an immediate supervisor who thought EMDR was just a bunch of nuts and hooey. And so I paid for the training myself. And when I actually got trained in EMDR, it amazed me just how much CBT there was in it. And CBT was pretty much the other big intervention other than 12-step at the agency. And so I thought, maybe if I pitch this to her in a way that is, well, here are the CBT parts of EMDR, and then the EMDR uses the body a little bit more. And I did that, and she let me do it with cases who seemed well stabilized, and I was still under supervision, so I had to get her clearance. And almost right away, I saw people having a lot of the experiences that I had. Shifts that talk therapy, 12-step just wasn't seeming to touch. At the agency level, I had to do a lot of I felt it was mostly phase 2 preparation, which was fine. Part of it was just par for the course of where people were at and the setting. But I knew to really spread my wings with EMDR, I needed a little bit more of an individualized setting where I could say, if you want trauma-focused care, here's where I am. And since then, EMDR has really defined my practice. It's not all I do, because I think the big fundamental of trauma-informed care, right, is you have to be an eclectic or integrated. You have to be able to meet people where they are. So it's not all I do, but the AIP model really drives all of what I do, whether or not EMDR is my direct intervention. And I know this sounds like such a cheesy commercial thing to say, but I see lives transformed because of this modality. And it still warms my heart when I hear people say things like, I've talked about this issue in talk therapy with 5 other providers for 16 years. And this process, more than anything, just seemed to let things shift. To me, EMDR is a mindfulness-informed, mindfulness-focused intervention. So many of the classic components of even the EMDR standard protocol, questions like, what are you noticing now? What are you getting now? Just go with that. Just notice that. To me, completely come from the mindfulness tradition. And I really think it reflects a lot of the commitment to mindful living, mindful work that Shapiro had in creating the protocol. So for me, by teaching EMDR, we're teaching an evolved version of mindfulness practice. As a teacher, I feel that really emphasizing mindful skill building in and of itself in phase 2, the preparation phases of EMDR, exponentiates even what the EMDR itself is able to do, at least what the public knows of as EMDR, the trauma targeting. For instance, in the standard EMDR protocol, a question we use a lot is, what are you noticing in your body? And I find such a difference with clients who have already been trained in even the core basics of mindful practice are more effectively able to do that within the process of the EMDR itself, especially the trauma processing components. And when they don't have that mindfulness training, it's not to say the EMDR doesn't work, we just have to do a lot of the education then and there when they're conceivably already ready to go with working on their trauma. But having the mindfulness as part of the prep, I think, just really brings the whole process together nicely. And that is something that we emphasize in our training. Just as part of our training program, one thing we believe in doing is using mindfulness skills during our training, really for clinicians to take care of themselves in between the lectures and the practicum. So we do a lot of breathing, we do a lot of mindful body awareness, we do some moving mindfulness exercises, and yes, of course, that's part of our teaching process, because we want to show you that these are skills you have at your disposal for your whole clinical life, especially EMDR preparation. But we also want to impart this idea that you as clinicians can use these skills to take care of yourself, whether you're at a long, extensive training or whether you're in your office. You have essentially a whole mindful tradition of things that you're able to do for self-care. Another conceptualization of trauma I really resonate with is this idea of traumatic experience causing stuck energy in the body. Traumatic experience keeping you stuck at the point that you were stuck in at the time of the wounding. And if being stuck is by definition about non-movement, whether that's in the limbic brain or in the body, why wouldn't we integrate direct movement as an intervention? Is it easier said than done? Yes, because I had a lot of clients freak out at the thought of you're asking me to move. Of course it's a step outside the comfort zone, but I don't think it's any more of a step outside than getting in touch with your feelings would be, or talking about things would be. It's just one more way in which we're called to meet people where they're at, so to speak, and notice what are the struggles with movement, and how can we use some other skills we're working on to help you kind of gradually step into using movement. And there's just so many ways to apply it and so many ways to use it. I'm really excited by the possibilities. I envision our training programs being small in nature, because I don't want this to sound demeaning in any way, but I was trained in a very large hotel-based, several hundred people, and I mean it was a good training. I got trained, but I felt a lot of the personal connection was missing that I often experience when I do trainings, let's say in treatment centers for a small community of people, where we're able to have discussions and go deeper. So it's always been my dream and my wish to do EMDR trainings, let's say that don't exceed 30 people, where the trainer gets to know everybody's names, where we get to go even deeper, of course, with the small group practicum and small group discussion. But I really like to see a growth of people in their communities doing trainings, as opposed to people from a community, let's say, having to travel to do massive EMDR training. I like the idea, like what Steve is doing with refuge recovery, of having a trainer be able to come in and train a whole system, if that's the system's desire. So I think that's something that distinguishes us, is this commitment to the smallness of the process, really adding to the richness of it.